There are many patients who come to us and tell us that, doctor, after I stand or walk for some time, I get pain down my legs, numbness or tingling down my legs, and I have to sit before I can walk any further. Very likely, yes, that these patients might be suffering from spinal stenosis. And if you are one of them, then this video is for you, where we are going to try and understand what spinal stenosis is and what can we do to treat it. Welcome to my channel Zen Spine English. My name is Dr. Rakesh Dhake. I'm a fellowship trained spine surgeon certified by the Royal College of Surgeons of England and currently working in Mumbai. So when we say spinal stenosis, what does the word actually mean? Spinal means in the spine and stenosis meaning tightening. So when there is tightening of the nerves in the spine, we call it spinal stenosis. As simple as that. If it is in the cervical spine, we call it cervical stenosis. If it is in the lumbar spine, we call it lumbar spinal stenosis or lumbar canal stenosis. So stenosis, why does it happen? Well, it is not a disease, but it is a structural change that is happening in your spine because of the wearing out process or the degenerative process. As we all age, we are all going to have it. Some people have it more, some people have it less. So when we age and when our joints in the spine become arthritic, or the ligament in the spine thickens, or the disc in the spine reduces in the height or slightly protrudes, all these changes together compress the nerves from all the sides, and that is what causes pressure on the nerves and is called spinal stenosis. Now, as I said that the most commonly it is because of aging, so it happens in patients who are 50 or more. Sometimes, yes, it can also happen in patients who are younger, but usually it is seen in patients older than 50 years of age. So let's look at what are the symptoms that we see in these patients. If it is lumbar spinal stenosis, then these patients have back pain radiating down to their legs. When they walk for some time, they have to sit because their legs become heavy, their legs become numb. Then they have to sit after walking for 5 to 10 minutes, and then they can walk further. Sometimes when they lean forwards, like on a shopping cart, they feel better because when you lean forward, the lumbar canal opens up and slightly relieves pressure on the nerve and the patient feels better. In contrast, when they are standing straight or extending their back, the pain worsens. This is because the canal further tightens and compresses the nerves, and this can worsen their pain. Along with that, they might have some weakness in the foot if this is a long-standing problem. They might also have urinary issues if this is a long-standing problem. In such cases, we will discuss what is the treatment in the upcoming section of the video, but these are the symptoms that we usually see in patients with lumbar canal stenosis. Talking about cervical spinal stenosis, now cervical meaning there is tightening on nerves in the neck. Now in the neck there is a spinal cord that is present, whereas in the lumbar spine usually the spinal cord ends at L1. So in the cervical spinal stenosis, the pressure is on the spinal cord, whereas in the lumbar spinal stenosis, the pressure is more on the individual nerve roots. So cervical stenosis is more serious than lumbar stenosis because in cervical stenosis, the cervical cord is compressed along with the nerve roots. So patient starts feeling pain in the neck and radiating down their arms. They might have heaviness, pins and needles, tingling or numbness in their arms and fingers. They might lose fine control in their hand grip, like doing fine activities like holding a pen or eating with fork and knife, eating rice with hands, or their handwriting changes, or buttoning and unbuttoning shirts is difficult. So all these symptoms signify that there is weakness in the hand grip. Along with that, they might also have balance issues. So after walking for some time, they might feel that they lose their balance and they might even fall. These are the symptoms in cervical spinal stenosis. So having understood the symptoms, now let's understand what is the common cause. As we have already discussed, the common cause is age-related, wear and tear, degeneration. So yes, degenerative is the most common cause. But sometimes there can be other causes that is causing pressure on the nerve. Like yes, disc prolapse can also cause pressure on the nerve. Other causes could be there is a tumor in the spine. So the tumor is eating up the vertebrae bone and it is pressing on the nerves behind. So yes, a tumor can also cause spinal stenosis. Other is infection. If an infection destroys vertebral body and starts forming pus, then that itself can press on the spinal cord or the nerves and cause spinal stenosis. If there is a trauma or if there is injury to spine, then the vertebra might be fractured or it might be dislocated, and in such situation, the fractured vertebra fragments can be pushed backwards and it can press on the nerves causing spinal stenosis. So these are the few common causes of spinal stenosis. Now what do we do for spinal stenosis? In the majority of cases, as I said, it is degenerative and age-related wear and tear. In such patients, we usually give them medicines, physiotherapy, rest, activity modification, ergonomic changes, and with all these measures, the pain might get better. Usually it does. If sometimes the patient does not feel better with this conservative treatment, then they might need surgery. If after walking for some time they have to sit repeatedly and their quality of life is compromised, then surgery might be the right option for them, wherein we go from the back and release the pressure on the nerves by a common procedure called laminectomy, and it can be done minimally invasive these days. When it comes to other causes than age-related, which we discussed were infection, tumor, trauma, usually in these cases, if the nerve is compressed, they usually need surgery to address the issue and sometimes also fix it with screws and rods. So that is about an overall understanding of what spinal stenosis is, what causes it, what are the symptoms, and what is the treatment option. If you have gained some information from this video, then please consider liking the video and subscribing to the channel. It helps us to reach people like you who are suffering from back pain, and we are trying to make a difference here by helping you live a pain-free life. If you have any questions or comments, please feel free to write in the comment section below, or you can WhatsApp us on the number given below, and we'll try our best to get back to you as and when we get time. Thank you so much.